All right. I think now we're we're live again. We're live again. Dr. Wahan with the Dr. Wahan experiment. What's going on? How we doing?
I'm good. I'm good. Thanks for having me.
Excellent. And thanks for coming on. Thanks for taking time out of your busy day, your busy week. You're in private practice, or?
I am in private practice. I've been in private practice since residency, and finished out back in Pittsburgh and moved back to Seattle. And I do some teaching at the University of Washington Dental School. So I've been doing that like for fun.
Gosh,
like,
it's coming in and out.
Ugh, is it the Wi-Fi?
Is it my Wi-Fi?
Maybe it's mine.
What is going on today?
Let me try something on my end to see if I can fix the Wi-Fi thing.
Yeah, it's like going in and out. I can't hear anything. Okay, I see that you left, but okay, I see you. It's blurry, but I mean, I see you.
Okay, can you hear me?
Your audio is a little lower. Yeah, I hear you. Your audio is a little lower too. Is that what you were talking about before with the?
Is it too low?
It is a little low, yeah. A little bit better. Could you turn up any more by any chance?
Try that.
That's a lot better. That's a lot better.
Okay.
There we go. All right. Hopefully this holds. What's going on? I'm sorry. So we were saying private practice, and then you said you were teaching for a while. If we could run through that one more time.
I teach at the University of Washington Dental School. So what I do is I do the clinic with the third and fourth years, and so I've been doing that since 2009, pretty much, for fun on some days off.
2009. You've been at it for quite some time teaching there. How long have you been in practice?
Yeah, 17 years.
17 years.
Yep.
How many teeth do you think you've taken out in 17 years?
Dude, I don't know, man. I mean, even in a week, I don't even know. It's crazy. I can't even think about it. It's too many. It's too many.
Any implants? Any big implant cases going on?
You know what? We do a fair amount of like full arch stuff. So that's always going on every week, every other week, depending. Definitely a few times a month we do those cases. But yeah, just the basic stuff in the office, the bone grafting, the implants, full arch stuff, that's all part of it. Just the whole gauntlet with the grafting and all that stuff, obviously. So
Of course. You said we. Who's we in the practice?
So I am in a group practice. So we have 4 surgeons total. We're actually getting a 5th from Parkland. Parkland, what's up? He'll be joining us in August. So yeah, there'll be 5 of us. We have 4 locations essentially, like just right outside of Seattle.
Wonderful. Where's this? I love the Wu-Tang shirt, by the way. Where's this new guy gonna go?
Well, so we all rotate between offices. So the way we have it set up is like there's 4 locations, 4 doctors right now. Every day we're just at a different office, so it just keeps it fair. And so he'll just join the rotation as far as which office, that sort of thing. One of our offices is big enough for actually a few surgeons to practice simultaneously. It's like 9,000 square feet, so it's plenty of space.
Oh, and so he's going to join into the rotation or just join the rotation, right?
Yeah, rotation. Everyone does the same. Keep it
awesome.
fair.
So are you always at the same location on Monday? Always at the same location?
It varies. There is a pattern. It's just I can't think of the pattern. I just get a text every night like, "Hey, go to this office in the morning." I'm like, "Okay." Let's kind of show up and work. So,
and are you a partner in this?
I am. Yeah.
Oh, awesome. That's great.
Yeah.
Okay,
yeah,
cool.
It's a pretty good setup. And we take trauma call and stuff at the hospital. We all share that. So with 4 surgeons, we're like every 4th week of trauma call plus office call for the week. And then with 5 surgeons, it'll be every 5th week, which is great. I mean, coming out of residency, that's really nice to have it.
That is
frequent.
Nice.
Yeah.
That's a lot less frequent. That is great.
Yeah.
Oh, excellent. And so 4 surgeons, 4 offices. Are you only doing 4 days a week, or it is 5 days?
5-day week is tough. So sometimes it's a 2-day week, a 3-day week, or a 4-day week. There are some 5-day weeks in there just because we built the new office and we have to, keep it going a little bit. But I think when the new guy gets here, there won't be a 5-day week. So the most will be like 4 days. I mean, it's a lot. It's manual labor, man. It's a lot of work.
It is.
Yeah,
but so
it's not just you can't do it remotely. You got to be there and like do stuff, right? Like physically. So it's a lot.
Remote oral surgery. One day.
Oh man.
One
That'd
day.
be so nice. I can't wait. So
how does that work? Some weeks you're 2 days, some weeks you're 4 to 5?
Yep. It just depends on the rotation for that week. Yeah.
Excellent. And how often are you able to really kind of escape out of the office, get on the podcast? How often a week are you getting a podcast episode up?
Oh my God. I just started this freaking thing. So I didn't even start social media until after the pandemic. And so like COVID hit and like everything went virtual pretty quickly, right? Because before that, I was doing like some live stuff, live lectures and stuff. Everything shut down. I'm like, you know what? Let me just start this social media stuff and show some stuff on Instagram or whatever. And I started off showing like I still make soap, my own soap. That's why my skin is so nice. But so I started it, like, showing like the soap I was making, and like that was going nowhere. And then like you know what? Let me just show some cases. And then that's kind of how it started. So I didn't even start it until I guess late. And I think I know the people that started it well before that, like years before that, grew really fast because I think at the time the algorithms were favorable and things like that. But since COVID and all that, I think the algorithms have really locked it down. So it's harder to grow that kind of stuff. Like surgical content is what I'm talking about. And
Yeah.
so yeah, that's been tougher. I've even noticed it in like the short amount of time I've been on it. It's been tougher. So the podcast stuff just started this year for me. I'm like, I need to do something a little more kid friendly maybe, or something to bust out of the algorithm, and just I don't know, it just seemed appealing at the just to get, because people always ask me questions. They're like, I get all these messages like, how do you do this, and for me to respond on my surgery channel, I just felt like it was like a niche of people that want that information, but maybe a lot of people don't want to see that. They just want to see surgery videos. So like, let me just create this whole new thing just for that kind of stuff and see where that goes. That's kind of how that started. So
interesting.
It's kind of like an experiment. That's what I thought. I'm like, it's kind of like an experiment. Let me just try this new account, see how this goes. And so far, I mean, I've only done 4 episodes, and literally the longest one is like 20 minutes. Like the first one was like 6 minutes. So it's not like a lot. But it's kind of like one of those things where I just kind of pick and choose topics at this point that I think are relevant, that or people ask me something, and it kind of sparks a little idea. And so that's basically what I've been doing. And I have the benefit of my other account, which has, a fair amount of followers now that ask me a lot of questions. So it's nice to get content that way.
Yeah. So that, okay. That's what that was going to be my next question. The secret, you pull the questions from one and then you make a podcast episode about that. That's great. Oh, I love that. I love that. So, okay. So you answer the question, where the question is coming from. You answer so the experiment started for this. It's to kind of serve as a separate platform where you're answering questions about surgery. Is it only surgery? No more soap?
No. There's definitely no soap, but there could be soap, because I don't think they censor soap. They censor like wisdom teeth extractions and stuff, but no, it could be anything now. I mean, I actually, there was a guy that had a song in the 2000s, Don't Want You Back, I think, Eamon, oh my God, Eamon. He said he'd be on my podcast. And then like, there's another rapper that's going to be, so it's not going to be all surgery stuff. It's going to branch out, but just starting it, I'm not a podcaster, I'm a surgeon, right? And so like, I'm learning as I go. So it's just taking me a little time to get the workflow part of it. Like the editing is like the worst
man,
part.
I love that though.
Yeah. So I'm kind of having fun with it, and just kind of watching a bunch of YouTube videos myself on how to do it and how to edit it and how to get it out there. And it's a lot of work. You know that. You probably figure that out too, right? It's a lot of work.
Yeah.
So.
Yeah, it is a lot of work, especially. Well, you just told me, I'm learning it from you too. You just told me that there's a Riverside Facebook group, Yeah.
I don't really get on the Facebook, but for random groups that people have on there, sometimes they're applicable. So like they have one. And so like, I've just been following it. And then people do ask some cool questions. I have the same questions I have, and I've asked a few questions on there too. I mean, there is a big dental group on there, the Dental Clinical Pearls. There's another big group on there on Facebook. But yeah, as far as little things like that, that's helpful. I just wish it wasn't on Facebook. They could put it on Reddit or something else. But it's Facebook.
No, it's funny you mentioned that. I'm not a part of like any Facebook groups, probably for the same reason, where it's like,
it's not a site that I typically go to anymore, right? So it's just, it's
so true. Yeah, like I don't go on there for anything. Maybe like, oh, is that person's birthday actually on the 17th?
That's literally the reason. It's so and so's birthday. Let me just text them or something. Like, thanks, Facebook.
That's literally it. Yeah. Where's your studio setup? I like the gray bricks. That's a good background.
You know what that is? It's a sheet.
I saw it moving. I was gonna say it's totally a sheet.
Yeah.
So this is at how
cat walks behind it, and then it wiggles. So yeah.
You found your cat, by the way. You said you had to find your cat outside.
Yeah. So she's a long-haired cat, and the cat lady comes. Cat groomer. I shouldn't call her cat lady. A cat groomer comes and shaves her up, gets her all ready for the summer, clips her nails, and does all the things. Yeah, she's looking good. So
actually shaved.
Yeah.
If it's a she, your cat's a she.
Yeah. Oh yeah. She's a she.
What's your cat's name?
Annie.
If Annie comes by, can we see Annie? Can I see Annie?
She's still getting shaved. I can hear her a little bit. Not her best part of the day, but yeah.
Oh, okay. All right. Well, we'll leave Annie alone for a little while.
Oh yeah.
I gotta get a dog. I gotta get a dog for this apartment. I graduate in a year though, so maybe I'll just wait till after.
Yeah, I
I don't
want
know.
a
Did
dog.
you?
It's just a lot of work.
Yeah, yeah. But you said you had to find Annie outside, so I guess it would be a little bit similar. No, but cats are less work. Did you have
Yeah.
Annie when you were in residence? How old's Annie?
Oh, she's like 8. No, I
8?
just got her
Okay,
like,
okay.
yeah, 8 years ago, basically. But yeah. So that's basically how the podcast thing came about. It was just like, I feel like I need to do something else. I felt the algorithm for the other stuff was like stopping a lot of things, and so this is just a better way to branch out for me and just be more creative still.
Yeah, I saw your post on how the algorithm's blocking out a lot of the surgery and the procedures and stuff. They're getting worse and worse. They're putting a stop to
Yeah,
everything, you know?
they are. Yeah, it's weird. Even for the short amount of time that I've been on it, that's what I've been noticing. And but you see other weird stuff that gets through the algorithm. That's like, whoa, how is this even like on there? But they block the other
Yeah.
stuff, So I don't know. I just feel like who knows what's going to happen with TikTok in a year. And I feel like Instagram, if they really wanted to, they could jump on that and just try to promote themselves better and help people out with that. But we'll see.
Yeah, I'd like to see them put some effort into the platform. Are you on TikTok?
Mm-hmm.
You are?
Yeah.
Oh, awesome, awesome. So what's your kind
That's
of
a whole
take on this
different
whole
thing.
thing going on?
TikTok is totally, it's a lot different than Instagram. I like it just because things come out on there faster. And then they get to reels, and so like you get on TikTok and then like, you see all the trends quicker, and then the audios that people like, you see that quicker. So that's why I really like it, because it's a faster way to get your what's out there, what's trending, and that kind of stuff. And then it gets to reels at some point, right? But TikTok is different. I have to filter my videos on TikTok. I have to make them black and white, and then I just basically all I do is take the orange and the red out of the video, and that really breaks through their algorithm so far for my content, which is
How did
more
you come up with
surgical.
that?
I just tried a bunch of different ways to, because on TikTok and Instagram does it too. Like if you go to a surgical account, half their or more than half their posts are blurred, right? Because they're showing something surgical, and sensitive content. You got to click the little thing and then open it up each time. TikTok, when you have sensitive content like that, they'll just black out your whole video. It's pretty much dead. It's like you never even made it. And so like to get past that, I just tried to take out some of the orange and the reds, which is the blood colors.
Yeah.
And that works most of the time.
Pretty good. I never even thought of doing that. And you've only been on social media, podcasting, Instagram, TikTok.
I mean, it works on Instagram a fair amount too. I have some videos like that on Insta too, but people hate it. It's like, oh, you got to show the whole thing. I'm like, I'm just trying some stuff out. Relax. You're getting free video, dude. You're getting a free video.
You're getting a free video. This isn't even OnlyFans.
She's should be like, I should charge for that. It's free. See, so it's not even.
So is that next? Is it going to be? So you're on TikTok now. What do you think? Little OnlyFans, surgical procedures?
Definitely not OnlyFans, but TikTok, YouTube, Instagram, all the things. The podcast, is on a hosting site, and then that gets churned out the various places, I guess now. So yeah.
You're doing YouTube also. Are you doing YouTube Shorts as well as long form with podcasting? Yeah.
Sort of. I haven't really had any luck with their shorts. I don't know. It's a lot of, like, with all these things, it's a lot of work. Like I work all day, and then I have to figure that stuff out. So I mean, you're a resident, right? You're busier than I am, and so like it's a lot of extra stuff. So
it is a lot of stuff, a lot of steps. I was considering, because you're making the reels and the TikToks. It's a different headline, different title on YouTube Shorts. Just from my experience, what I've been told is, you change the title because it's YouTube's the second largest search engine. Hey, give that a shot. I'm curious to see how. It is a lot of work. Just same video, cross it over, put a different headline, like a search board.
Yeah, you can kind of use it, but they're cropped differently and things. So like, yeah, sometimes they don't show up the way you want because the framing of it is off for their, so all those little things. I try to shoot my videos in 1:1. So they work in all the formats, even though they might be a little smaller looking. It doesn't cut anything out. Like if you go from a reel to a post to a TikTok short or to a YouTube short, if you film it at 1:1, I found it, you don't have to mess with it too much.
Yeah. I know exactly what you mean. Yeah.
Or you can micromanage it and like just frame it for each one on your own. That's a lot of work. like 10 extra views.
So
I don't think I want to do all that.
Yeah. That is. What's your next podcast plan? Like the next episode, let's say.
So I am working on the algorithm one. So now what I'm doing is going to talk about just what we've been just talking about a little bit, is about how the algorithm has been tricky to manage through, and what I've found works and what doesn't work, and what other people have sent me like on their end. Like there's like surgery posts that get flagged for like nudity, like really there's no nudity on this post. It's like a tooth extraction. And so like that's how bad the algorithm has got. It's like, oh, goes against our guidelines on nudity. I'm like, so it's banned, and then you get shadow banned, and you can't even like do anything about it. So yeah, it's just stuff like that.
It's
Yeah,
been
and
really
then
rough. Yeah.
yeah, it is. So I think I think they have an easy way to fix that. I mean, honestly, they could literally have little clickers on there, because they do have it a little bit. Like if you go in your Instagram settings and get in there, you can allow different content on there, but they still don't have it where you don't have to uncheck every box every time. But they could do that if they wanted to. They could say, hey, if you want to just have the surgical content show up on your feed, just click this box. If you don't, click it, and we won't show it. They could do that if they
It's a
really
great
wanted
point.
to.
Yeah.
Right. So yeah.
It would be that easy. Yeah. It's kind of
Right.
like, when you post on the podcast and it says, is it promotional content or not? Like, so
Right.
is this surgical content or not? No, it's a great point. It's an easy fix.
Yeah.
Well, what are we going to do? Hey, this is running pretty smooth. I'm seeing you a lot clearer now. This is great.
Yeah. I had the door closed because I didn't want to hear my cat screaming, and so that blocked the Wi-Fi, I think. So I think we're good now.
Any screams when she's getting her hair
No,
cut or
it's
trimmed?
no, it's a couple of meows. It's not bad. PETA, just watch it. Watch it. It's totally fine. All right.
Okay, all right, fair
Yeah.
enough. So what's your typical day look like in the office? What time you going in? You said you rotate between the offices. You get a text and you go in.
I do.
What's like your day? What's your day look like? Yeah.
So I live in Seattle. My offices are a little bit north. So I when I get out in the morning, I wake up probably around 5-ish, and then I'm out of the house by 6 a.m. And I start surgery at 7. So first patients are at 7. And so usually we try to do all our surgeries until 1, have a little 30-40 minute break, and then you're back to consults and post-ops and stuff. And during the morning, you're also seeing consults and post-ops between surgeries and stuff too. So that's all day.
Yeah.
We try to get our surgeries done by 1. Obviously, as a surgery practice, sometimes that doesn't happen. You have emergencies coming in, so but yeah, we try to get them all the scheduled surgeries done by 1.
Sense. I like that.
And then we're out by 3:30.
That's great.
Yeah.
So you get up at 5 every day and you're in and out. You're out of the house in an hour?
On work days. Yeah. So this week I actually have a 5-day week. I'm on call. But I think next week's a 4-day week, and then maybe a 3-day week or something. I don't know. Something like that.
You work any weekends?
Just if you're on call and something happens. Yeah, but not
How often are you on call on a weekend?
Every 4th week, we do the whole week at a time.
Every 4th week, the whole week at a time. Oh, okay. So you're on this whole week?
Yeah, until Tuesday.
Next Tuesday. Oh, okay. I follow now.
Yeah.
Okay. I'm just trying to get a,
No, we just do it Tuesday to Tuesday, and it overlaps with hospital call and office call at the same time. And so whoever's on call gets slammed with everything. And then you're off for 3-4 weeks, and you're like, it's nice. So
it is nice. Yeah. Yeah. And have you been in this practice the entire time since you graduated residency?
Pretty much. Like, honestly, when I first got out of residency, I started in a downtown Seattle practice, and it was terrible, and lasted there only a few months, did some locums work, and then I found this practice within like 8 months of being out of residency, and then I started as an associate. Yeah.
Great. Why was the other one horrible?
It was just a bad situation. Like, there's some residency stories people have, right? Like, great practice, things like that. I'm like, I didn't really know a lot come out of residency, and like there was only like 2 operatories, and like when the other surgeon was there, like what was I gonna do? He wouldn't let me see his referrals. I had to get my own. I'm like, how am I gonna get my own referrals right away? Like, I don't know anyone. I just graduated. There's only 2 operatories. It was a mess. I'm like, why do you even need an associate? And so like it didn't last very obviously.
That
but
makes
thankfully,
no sense.
yeah, I know it worked out in the end. But having to go through that, it's just, those are the questions you need to ask, and I try to mentor people through dental school now, all the students and stuff. And when they graduate dental school, they often ask me, like, if they're going into oral surgery, they'll ask me questions. I tell them ask those questions, like, like, am I going to see all the patients? Like, you're going to limit my patients? Like, I know some surgeons say, yeah, you can't see the implant referrals. Those are, you got to get your own. You can't do sinus lifts. I do those. Little things like that, just to ask the right questions. So that's a big deal. We don't limit anything in our practice. It's just like, yeah, you're a surgeon. You should be able to do what you're comfortable doing. We're not going to limit you. So, but some practices do.
Right. Is your practice, you take all insurances, some insurances, none?
Yeah, we take insurances. Yeah. I mean, Boeing is here, Microsoft is here. So there's some big groups with mega plans and things. So yeah.
That's right. Boeing, Microsoft. Yeah. In the Seattle area. I mean, you got a lot of stuff over there.
Yeah. Amazon, Boeing, Microsoft. I mean, it's there, it's around. So yeah.
Starbucks, right? Is that nearby or is that a different part?
No, I mean, they started from here, but yeah.
Do you drink coffee?
I do. Yeah.
Starbucks or other?
I don't care. I don't really. Yeah, I do drink Starbucks. I mean, it's mostly just espresso or something, but yeah.
Gotcha. I've been a big fan of Dunkin' lately. I don't know what it is. Something about
like
the taste
Dunkin'.
of Dunkin'.
I went to school in Tufts for dental school in Boston, and
Oh, so you know Dunkin'? You know Dunkin' really well.
Yeah.
All right, Dunkin' or Starbucks espresso?
I mean, Starbucks probably, or something like that. Dunkin's great for like you were out drinking, you get a coffee in the morning, on your way to school real quick. Like it's nice. It's with a little sugar in there. It's nice.
It's like a little vanilla iced coffee. You're right. That's a good point.
Like give me a small regular.
On the
Thanks.
Way. Yeah. Doc, you're here again. Yeah, they already know your name and everything. That's good.
Oh yeah.
Awesome, good stuff. And then where did you go to residency?
Allegheny General in Pittsburgh. And so I went to dental school in Boston at Tufts, and then I matched to 6-year program in AGH, and then finished that in 2006. So it's been a while.
Is that so? Allegheny, is that still, because there's Geisinger over in that general area, two separate, right?
I don't know if that's in Pittsburgh though, is it? But yeah,
no.
I think, at the time AGH was a 6-year program. Now it's 4. But I was there during that time.
What's your thought on 4 versus 6?
I don't know. So the thing with that is I just applied to the 6-year programs, and the reason was I didn't know what I wanted to do when I was thinking fellowship. I was thinking oncology fellowship. And so I wanted to keep my options open. I thought that would be more beneficial. And I was even thinking maybe switching to medical school, like once you're done with medical school, going into an ENT residency. Honestly, I was thinking that far ahead, just in case.
Wow.
Because I thought if I wanted to do oncology, that would probably be the best way for me to do it politically, versus as an oral surgeon. And because that just depends where you're at, if you even get those cases. And so that's what I was thinking. And so that's what I did. So it's really an extra 2 years, 4 to 6. And so didn't seem like a lot. And so I was like, all right, just do that. So that was basically my thinking at the time.
Like that. No, that makes sense. Why didn't you go for it?
I did. So I after medical school, I went through the ENT match, and I had an interview actually back at Tufts, and another interview. And after I did the interview, some life changes happened. I was like, you know what, let me just finish my residency, and I think I'm done flirting with ENT, and I'm happy I did that. That worked out in my favor. So, but at the time, when you're in school, your head's down, you're like going. It's real easy to keep staying in school. I feel like it's especially if it's a predictable thing, you have a schedule. So, when I finished residency, I was 32. I didn't take any time off. And so that was my first job when I was 32. It's a long time to be in training, right? So I don't really count residency as a job. It's more like slave labor kind of thing, but so.
Agree.
Yeah.
I definitely agree.
Yeah.
Until you're a chief and now you're like, wait a minute, this is residency.
Yeah.
Are you from Seattle originally?
I am. Yeah. I grew up here.
Well, that's why you went back. So you started in Seattle, did college and everything, went to Tufts, all the way on the opposite side of the United States. Came back a little bit to around Pittsburgh, and then you came back. Okay. So I guess family's in this area, right?
Yeah. I grew up here, my parents and stuff. And but still, it was nice to be away. And Boston was amazing. I love Boston. So
yeah, definitely different side of New York and everything. Boston's fun. I haven't been there in a while. That's a good spot. It's Tufts in the heart.
It's downtown by Chinatown. Yeah, it's right there. It's not at it's not at the undergrad campus, which is in Medford, but it's downtown.
Okay, gotcha. Downtown. Is it true that it rains a lot in Seattle, or is that just?
It's true, and it's really not even the rain. It's like the gray clouds and stuff. That even now, even growing up here, that gets me now. I'm like, all right, maybe in a couple of years I'll go somewhere warmer. We'll see. I don't know. Anyone looking for?
Really?
You're just kidding.
Kind of. You're kind of thinking about it. You're kind of thinking about leaving. Where are you going to go?
Sometimes I don't know. Somewhere warmer. Why not? All right, hit me
thinking
up.
Like Florida, Texas.
Oh, never know.
And what are your thoughts? You don't know? Yeah. All right, I got it.
Yeah.
What are your thoughts as far as DSOs? Because you're in a multi-practice now, right? You got
Oh
4
yeah.
locations,
Yeah.
5 surgeons coming on. I'm sure you're getting offers.
Right.
What are your thoughts with this whole movement, this whole board?
Right.
And then
So,
we could wrap it up from here. I don't want to take up too much of your
oh
night.
no, this is a big topic. Like I even tell residents coming out, like when I meet residents at the meetings and stuff, they, I ask them, they tell me things, and I'm like, you need to ask these questions to these people you're interviewing with, and it's a lot of it is about DSOs, and so that's a big deal. I think in about 10 years or so, most dentistry will be corporate, right? It's heading that way, like medicine and surgery. So how many ENTs do you know that are private practice? Almost zero. They're all corporate, right? Pro-alliance surgeons. You got all these mega groups, anesthesiologists, same thing. All these surgery specialties are going corporate, and the same thing is happening with dentistry, right? So you're going to see and everyone's selling to DSOs because they can get more money essentially to sell to a DSO rather than, hey, do you want to buy my practice for, let's just say 600,000, and where a DSO can pay you double that, multiplier or whatever, and maybe a stock thing. So it's like almost like a no-brainer for people to sell, and then they don't have to worry about the HR, the hiring, the firing, which is kind of a pain, right? So a lot of dentists are selling to DSOs, which means corporate dentistry. And then since we're a specialty-based practice, oral surgeons, right? If they start referring to their own DSO people, we're going to lose our referrals, and then that makes it even harder for us to operate. So they're kind of forcing everyone's hand, I think. So they're going to get these multi-specialty groups referring within their specialists network, and then all our other referrals are going to be drying up over the next 10 years or so because we're not affiliated with the corporate people, or if we're not a DSO. That's what seems like it's going. And they're offering more money to graduating dentists and residents. Like, up front, it seems like they're offering more money than a private practice can pay at this point, because
They
of
are,
their
but
overhead.
it's a
And
high floor, low ceiling.
no, I know what you mean. And so like it's appealing. Like you're coming out of school with like, I don't know, 500K in loans, 300K in loan, whatever you got your loan debt to start thinking about. It's really appealing. You can go to Aspen and make 700K, they say, or whatever it is. It's just it's ridiculous. And the private practices, I think, are having a harder time matching that initially because you got to buy in and do all these things. And so, yeah, it's tricky. I think it's tricky. It's even tricky for us to hire people because we're competing with DSOs. So I think it's just in 10
But
years, it's going to
DSOs
be a lot
don't.
different.
Yeah, it is. It is. It's going to be interesting and that's a great point you were mentioning about they're monopolizing. They're monopolizing, keeping everything within the network. The other thing that they're doing is as they monopolize, they have more leverage and bargaining power to ask those insurances or demand those
Oh,
insurances to raise their fees.
with
Whereas the mom and pop
materials and
shop
everything.
or your
Right.
materials, the implants, and then going from 4 offices to 27 big in a DSO, the
Right.
insurance company that you asked for, I want these extractions let's increase the reimbursement rates here. And they're like, well, what are you going to do? And you're going to say, well, for practices, it's tough. Here's my question. Is it better dentistry though? Is corporate dentistry better dentistry?
I don't know. It's hard to say. I just know that at this point, I think it's the wild, wild west, to be honest with you. I think there's DSOs that buy practices that you would never know that they're a DSO. They don't really mess with the the autonomy of the practice. They don't really do much. But I think that's the early stage, and then once they resell and do all these things, like it'll tighten up. We're probably just not there yet. But so I mean, at some point, it's going to be all corporate, I think. And so like, yeah, there's going to be good surgeons. I mean, there's good corporate ENTs. Like that's where they're at now. They're all corporate, pretty much. And so like they're going to have good providers. I think people are good providers because they care and they do the work, whether they're at a DSO or not. But I think that's just the way the landscape is going to go. You're probably looking at jobs, right? You're going to be in that area. You're like comparing private practice to DSO money, and like there's a lot that goes into it now. So
Yeah, I'm not really getting persuaded by well, we'll give you equity in the company. Yeah, but that equity, it's a pizza pie. The pie's the same, but your slice is going to get bigger. It's going to get smaller as they buy and sell their own practices without any regard to your interest in it. So
yeah,
I think like that nest egg for retirement is going to change too, because in a private practice, that's a golden nest egg. But in the DSO, it's a big golden nest egg or it's a small little chocolate egg that's, in the Easter
yeah.
basket. I don't know. Yeah, it is interesting how it's going to change, but as far as your mentoring, because you're teaching at what day do you teach at school? Is it one day? Is it because your schedule and practice fluctuates?
Right, right. So it could be like it's usually like a Wednesday, and we've been doing like a half day. We all rotate the teaching, so it's not all the same.
Oh,
It's all four of us do it. So yeah, it's not bad.
they want Dr. Wahan in there. They don't want any of these other guys. They want you. They want you in
I'm
there.
not gonna. I don't know. We'll see. But yeah, no, it's fun. It's fun. But yeah, you're right. I mean, most dental students now have some form of social media, right? And then so like, there's a lot more people going through that. This is my dental school journey, and this is my account, and they transition their account when they graduate to a professional account, maybe, and it's a thing, right? Yeah, it definitely is a thing. So
Yeah,
it helps.
yeah,
It helps.
It's funny you see these trends. And then,
residency programs have social media accounts. I mean, like I get so many questions on, like how do I, get ready for residency? What do I need to do? I'm like, I've been out of the loop a little while. Follow all these accounts, like follow Rutgers, follow everyone like that has like, really good accounts that show what they do. Interact with them. Don't be a pest, but interact a little bit, and you get to know it, and that I think that's helpful. Now that you have access to that stuff.
agree. Yeah. What's your biggest advice to a dental student and biggest advice to a resident, maybe young practicing surgeon, if you will? Two separate pieces of advices, and we'll call this the last one.
Well, I mean, for a dental student, are you thinking a dental student wanting to specialize? That's let's just say it's a dental student who wants to go into oral surgery, right?
Sure,
Yeah, people
sure.
ask me questions like that. And so I tell them the same thing I just said, like follow these other accounts, follow all the residencies, do some externships, extracurricular stuff helps. Do your externships and don't be a freaking pest on your externship. Don't be the student that ask a million questions, because that's also annoying. Do your work, show up early, stay late, do all the things and just be there, make it seem like you're super interested without being annoying. Just being honest with you guys. But yeah, I mean, people like that. It shows dedication. I did externships while I was at Tufts in dental school. I did like 2 of them. One was a month long.
The best.
And so like it really helps. I feel like that
A
stuff
month?
still really helps. Yeah, I did one at University of Washington. I did for a month, and then I had one at USC for like 2 weeks. This is my 3rd year of dental school. Yeah.
USC is Southern California.
Yeah. So
yeah, you were looking to come back here, and then you ended up in Pittsburgh.
Yeah. Yeah. Well, at the time, AGH was doing a lot of cancer, and I was thinking oncologic surgery and stuff, and so that's why it was appealing, part of it, because at that time the OMFS residents were taking ENT call because the ENT didn't have a residence there. So you were basically also taking the ENT call, which is some of it's a pain in the ass with all the nosebleeds, to be honest with you. But those are the worst calls.
It is.
Those are the worst calls. Like they call you at night and you're like, 2 a.m., so-and-so in the ICU's got a nosebleed. I'm like, he's got on warfarin, he's on, I'm like, or heparin drip or whatever. And then like you pack it, it takes you like 45 minutes to get everything in there and do it. And then you go right back to bed and you get paged again. Oh, he's bleeding again. I'm like, that's like your night, man. Like pack that person 2 or 3 times that night. And you're like, other things going on. You're like, those are the nosebleeds were like my worst. Like I hated those, to be honest.
They are. I'm not gonna lie.
I could do anything else. Like I felt like with a nosebleed, I just never knew if it was gonna work. Because they're always on a blood thinner.
Coming out. Yeah.
It's always somebody on a blood thinner. Yeah. So
yeah. I'm not gonna lie. I got my last night on call. They called me and they were like, "Hey, we got a really bad bloody nose coming down here. If you could take a look." And I was like, "Oh, hey, what did ENT say?" And they're like, "Oh, what did they? We didn't call ENT. And then I got them on their heels a little bit, and then they ended up calling ENT. And
yeah,
but it was literally 3:00 in the morning, exactly like you said. And you're like, you're just trying to sleep another hour, and
yeah,
it was well. Anyway,
yeah.
What would be okay? Last question, then we'll wrap it up. Say if you were to go back, you're restarting over. You're just about to finish residency, or you're 1 year in. You're in that position that you didn't like, for example, young dentist, young oral surgeon. That would be different advice from a dental student, right? What would you say? What would be your number one piece of advice, mentally, physically, viciously?
I mean, this is good because, like I said, we're bringing on a new associate just out of residency in August, and I'm like I said, before, we don't limit what you can do. Do what you're comfortable doing. You know, if you want to do sinus lift, you want to do orthognathic, you want to do TMJ surgery, do it. You know, this is the time to do it. Like when you're fresh out of residency, all that skill set is still fresh with you. You know, you don't do that kind of stuff for a period of time. It's harder to go back to it. You know, so keep doing it, keep pushing it, honestly, because that's likely what's going to happen. And we don't limit you. Go to a place that doesn't limit you. Like, you know, if you go to a place and you want to do TMJ surgery and they're like, oh, we're not set up to do that. You know, they're looking at their books. They're like, oh, then we have to get this software. We got to do this. And you know, they try to make it so you can't do it, basically, right? Because they're going to have to pay more for you to even do that stuff. So like, you got to make sure you ask the right questions. Like, you know, are you guys set up? If I wanted to do orthognathics, you know, I need this software. This costs this much. You know, we need a, you know, a camera set up with a light bulb. You know, need all the things, right? So like that's all important, you know. So make sure that they're willing to do all that if that's what you want to do. You know, you're going to a place, if you're going to start doing stuff you want to do and they're just like dental alveolar, then you've got to make sure that you have your stuff, right? And they support it. So
right. And you're doing a lot of like the all-in. Yeah. And you're doing a lot of all-in-X cases. So you got the whole setup. Did you have that set up there when you started?
No, I mean, I did my first full arch case like that probably about 14 years ago now. So it's been going a while. But now we're doing like the photogrammetry, all that stuff too. Like every couple of years, there's some new technology that we're looking at, and you know, and so like it's helpful, and so like that's really a lot for more the restoring dentist or the prosthodontist. That part of it, like getting the temp made ahead of time. Like we're just putting in fiduciary markers in order, you know, so it's not a big deal surgically for us, but it's really for them to get their landmarks and stuff. So yeah, we incorporate all that. But yeah, that's fun stuff for me. I like those surgeries a lot. If I could do them all the time, not that I want to work at Clear Choice, but it's a nice part of the practice. It's a nice part of the practice. I mean, I like them. I wouldn't want to do them all the time either. You know, I like doing other stuff, but I think they're a fun surgery to do. And it's rewarding because it's so like all of a sudden, you know, they have teeth and they're happy. I love that part.
Isn't it awesome? It's like, it's life changing. They're walking out with teeth in their mouth. It's, you're right. It's a beautiful part. There's a beautiful side to oral surgery and dentistry that we get to participate in and experience, and also provide. I think that's a great thing. Yeah. Well, Dr. Wahan, thank you so much for coming on. I really appreciate you taking the time, man, having a chat with me. I hope Annie's doing okay.
Yeah, I'll check her out in a little bit. We'll see. Should be all right.
Awesome. And we'll plan for a part 2 down the road sometime.
All right. Sounds good, man.
All right. Thank you.
Thanks.
Have a good night.
Bye.